Our next guest, Susan Taylor, probably most of you know her. She used to be on the local NBC, was it?
Channel 7.
Channel 7,
KNSD.
KNSD. Of course, everybody did that. And she was there for, what, 11 years?
16.
16 years?
Yeah.
That was close.
Yeah.
16 years. So a lot of people know the face, but in 2011, she stopped working there and has been working at Scripps since then as the executive director of external affairs. And what we did is we left a summary of who Susan Taylor is today on your tables. So I'm not going to bother to do that. But basically, you're going to talk to us about gizmos, gadgets, and newfangled things from Scripps, correct?
Yes.
Okay, so without any further hesitation with me stumbling over my words, here's Susan.
Thank you. But let's talk about gadgets, gizmos, and good health, okay? Let's be honest. How many of you get up in the morning and the first thing you do is check your cell phone, right? And how many of you get into bed at night and the last thing you do before you go to bed is check your cell phone, right? Send a couple of emails, post something on Facebook or Twitter or Instagram. Can you believe that 34 years ago, cell phones did not exist? And the cost of a cell phone was a bargain. Anybody know what price the cost of the first cell phone was? How much it cost? Huh? $1,000. What, how much? 300. Anybody else? 1,400. It was a bargain at $4,000. And the World Wide Web as we know it did not really exist in a cohesive way before anybody guess what year? 1992. What? 93, 92. Anybody else? It was actually 1989. You were close. And who developed it? No, it wasn't Al Gore. I know. I get that all the time. It was actually this guy. It was Tim Berners-Lee, a British scientist based in Switzerland. The World Wide Web was originally designed to share information between scientists and universities and institutes around the globe. So the world has changed with lightning speed in the last 35 years. At Scripps, we are devoting a lot of time and money to digital health, mHealth, mobile health technology. And there's no shortage of gadgets and gizmos out there, both big and small. Want to talk high tech? Take a look at this. Tony Fernandez became paralyzed from the waist down after a rare cancer attacked his spine. He was bedridden for months, and now look at him. Thanks to philanthropic dollars, these $100,000 robotic legs put Tony back on his feet. This is the exoskeleton. It's a bionic suit. The rehab center at Scripps Encinitas was the first place in San Diego County to test it out. In his darkest hours, Tony promised his wife Cindy that one day he would walk again and hold her hand. Tony is now cancer-free. And as you can see, he and Cindy are pretty happy about the road ahead. Now, diabetes is one of the top 3 health concerns along with heart disease and cancer. There are 28 million diabetics in the United States. By the year 2050, diabetes will affect 1 in 3 people. Scripps takes care of more than 27,000 diabetes patients across San Diego County and is ranked #1 in San Diego and among the best in the nation for diabetes care. We help people like Taisha. The mother of 5 slept all day long because of her out-of-control diabetes. She was in pain, she was depressed, and when she went to kiss her kids goodnight, she said that she felt like she was dying and each night would be the last time that she would see them. But then Taisha came to Scripps. She is enrolled in a clinical trial, testing out this new device to help control her blood sugar levels in real time, giving her instant feedback no matter where she is eating, at home or in a restaurant.
I can be that mother to my children. I have so much energy, I have so much life, and to just be sitting here knowing that I'm about to embark on something new that can help me even more. I'm at a loss for words. They saved my life. So, thank you.
apologize for that video not working there. In any event, the Scripps Whittier okay, there she did. She cried at the end. She was very emotional. She's such a lovely woman. The Scripps Whittier Diabetes Institute now has a 5-year grant from the National Institutes of Health to fund an innovative clinical trial to improve type 2 diabetes management among high-risk Hispanic patients in San Diego County. It is called the Dulce Digital Me Study. So half of the 414 participants will get personalized text messages to encourage proper eating habits, physical activity, and remind them to monitor their blood sugar level and take their medication. They'll also have to respond via text to questions about their diet, exercise, and stress levels. The other half of the study's participants will get a standard one-size-fits-all text message. We'll see which one works better. How about a breathalyzer to detect lung cancer in its earliest stages? There are several companies out there testing out a device that actually connects to your smartphone. It's got biosensors that actually sample your breath, searching for certain chemical compounds associated with lung cancer. This came about because of dogs. They can actually smell the chemical changes in your breath, and obviously you breathe into your phone all day long. What does that mean? Well, for cancer, early detection saves lives. At Scripps, we are replacing traditional one-size-fits-all medicine with individualized medicine. Genomic sequencing is the window to a brave new world. Take the blood-thinning drug Plavix. People spend $10 billion a year just on Plavix. Turns out it doesn't work for a third of the people who take it. Scripps was first in the country to come up with a simple blood test that will tell you if Plavix is working with your genetic makeup. If Plavix doesn't work, maybe aspirin works just as well for you. But wouldn't you want to know before you start spending money on an expensive drug? Back in November 2016, a Scripps Health patient became the first person on the West Coast to be implanted with this device. So this reduces the risk of having a stroke by closing a small hole in the heart. Dr. Matthew Price placed the tiny device in a female patient during a 45-minute procedure. Now, roughly 30% of Americans have a small hole in between both sides of their heart muscle. In most people, it spontaneously closes after birth. The defect is not a problem. It does not require treatment. But it appears that this hole might play a role in certain types of strokes, allowing a blood clot to pass through the heart and then travel up to the brain where it causes a stroke. This implant is low risk. The patient is awake the entire time. So once the tip of the catheter is positioned in the hole, this pair of mesh discs are unfolded and clasped together. There's the mesh disc. And it closes the hole. In an 8-year study that paved the way for FDA approval, 499 patients ages 18 to 60 were treated with the device plus blood thinners, while 481 patients only got the medication. The group that had the implant, they had a 50% reduction in the rate of new strokes compared to the folks who just got the blood thinners. Some 2.2 million people in the US have what's called AFib, atrial fibrillation. This happens when electrical impulses that control the heart become erratic and they interfere with the heart's ability to pump blood. As a result, blood can pool in the heart and form blood clots. If they travel to the brain, these blood clots can cause a stroke. So a lot of people with AFib take blood thinning medication to reduce their risk of stroke, but you bruise a lot more easily with these medications, and it actually raises the risk of life-threatening bleeding. Enter the Watchman. So the Watchman reduces the stroke risk and possibly eliminates the need for blood thinners. Scripps Clinic has done more implants of the Watchman than any other facility in the entire US. Dr. Doug Gibson is the #1 implanter in the country, and he's one of the top 5 doctors implanting the Watchman worldwide. So this device is implanted into the heart without surgery. The patient is given a local anesthetic. The catheter is inserted through a small incision in the groin, and it's threaded through a vein up to the heart. The procedure takes about 2 hours. Patients spend a night in the hospital, and 45 days later, they can stop taking their blood thinning medication for good because the Watchman is now on duty. So you can see why U.S. News & World Report consistently ranks Scripps as #1 in San Diego and among the top 20 in the nation for heart care. Breast surgeon Dr. Mary Wild is conducting a clinical trial for breast cancer patients using what we affectionately call the pink Mobi. This pink Mobitron machine right here, it actually delivers radiation right there during surgery for certain types of early stage breast tumors, eliminating the need for 5 to 7 weeks of follow-up radiation. My mom, who was an 18-year breast cancer survivor, had 6 weeks of follow-up radiation 5 days a week for 6 weeks. So with the Mobitron, you walk in having cancer, you have the surgery, they take out the tumor, they use the Mobitron to deliver the radiation right there, and you walk out cancer-free. Talk about improving the quality of life for breast cancer patients. And while we're on the subject of cancer, this is not a gadget or a gizmo, but it is a game changer, and it is worth mentioning. Scripps has now formed a partnership with the #1 cancer center in the country, if not the world. The new Scripps MD Anderson Cancer Center is going to offer adult cancer patients across Southern California greater access to world-renowned oncology care, including the largest number of clinical trials for cancer nationwide. And in most cases, once everything is up and running, and we're creating 2 Scripps MD Anderson Cancer Centers, one is going to be east of Scripps Green Hospital, off Torrey Pines, and then the second one will be down on the campus of Scripps Mercy in Hillcrest. In most cases, when everything is up and running, and that will happen in the next year, you will not have to go to MD Anderson in Houston for those clinical trials. You'll be able to stay right here at home. So, to give you some perspective, Scripps has 15,000 employees at our 5 hospitals and 27 clinics, and we deal with you from head to toe. MD Anderson has 21,000 employees who deal with nothing but cancer 24 hours a day, day after day, year after year. So together, we are going to make cancer history. And I just want to let you know that this is not a clever marketing scheme. This is a fully integrated program. Our doctors will go through the same protocol that the MD Anderson doctors have, and we will actually replicate MD Anderson's model here in San Diego. And it's interesting because MD Anderson actually came to us because they were really impressed with the way we took care of patients. They were particularly impressed with the way we took care of breast cancer patients and skin cancer patients. But because they deal with nothing but cancer, they also deal with all the really rare types of cancer too, because they are a comprehensive cancer center, and they literally are the #1 cancer center in the country. So we're very excited about this partnership. And one of the things that they were most impressed with the way we deal with our patients is that we deal with them kind of in a team way. So our patients tell us that once they hear that word cancer, they don't hear anything after that. And so you need somebody to literally hold your hand and walk you through the process. And MD Anderson is very focused on that team approach as well. Okay, I'm going to pass this around. They say that stress kills. It also leads to poor job performance, and we can't have that in the healthcare field, in any field for that matter. So I'm passing around this thing called the Aura Ring. Staff at Scripps Green Hospital, they were taking part in a study involving this Aura Ring. This ring continuously measures your heart rate stress, and it analyzes your voice for signs of stress. When you have little or no stress, let's say when you're relaxing at home, you have a higher variability in your heart rate because you're breathing in deeply. So let's say it's an average of 1 beat per second. The gap when you're not stressed might be 0.92 seconds for one heartbeat, and the next one might be 1.22 seconds. When you're stressed, there's less variation in your heartbeat because your breathing is faster and it's more shallow. So 40 folks have been wearing this Aura Ring. Data is being transmitted to the smartphone and then up into the cloud. They'll be tracked 24 hours a day for 6 months. They'll also get feedback on how to relax. And at the end of this trial, we will analyze the data to check for ways to lower stress. And at the end of this study, we might actually broaden this to patients because data shows reducing stress for patients while they're in the hospital actually results in a shorter hospital stay. They go home 1 to 2 days earlier, which saves the patients money. Now this device, the DynoSense, is undergoing FDA approval. You put your finger on the sensor, you put your thumb on the silver bottom, your lips on the silver top. The silver thermometer right here goes underneath your tongue, and then you blow hard and fast into it. Your finger senses the level of oxygen in the blood. So for folks who have COPD or asthma or other lung problems, this way you can calculate blood pressure. The thumb gives you 30 seconds of an EKG, your heartbeat, your pulse rate, to see if you have any heart rhythm problems. You don't need the big cumbersome blood pressure cuff. And the thermometer checks your temperature. You'll be able to track day-to-day changes and abnormalities. So lots of times people go to the doctor and their blood pressure is elevated. Why? Because they're nervous about going to the doctor. But aren't you also stressed out driving 3 kids to soccer and piano and dance and rushing home and trying to get dinner on the table, and you're late getting home from work? This actually allows your doctor to monitor you in real time without having to go to the doctor's office. And the doctor can see how these changes occur day to day versus one time 6 months ago at your last doctor's visit. This is particularly good for folks who have high blood pressure. The number one risk factor for the highest death rate is high blood pressure. It is more than smoking and diabetes. Roughly 30% of the people in the US don't know that they have high blood pressure, but because there are really no symptoms of it, but they are at risk for a heart attack or stroke. So once this device and others like it get approved, folks will be able to get an accurate read in real time outside of the doctor's office. This allows the patient to take control of their health. The data is also shown to the patient on their phone so they can see the trends. How about a robot to help with your knee surgery? This is available now at 3 Scripps hospitals, La Jolla, Mercy, and Encinitas. It adds an extra layer of pre-surgical planning and improved precision for partial and total knee replacements. It allows for the creation of a highly individualized plan based on the unique shape and motion of the patient's knee. The Navio won FDA approval in March of 2017 for full knee replacements. Scripps surgeon Dr. David Fabi has performed more full knee replacements using this Navio than any surgeon in the world. Now this is called the Mazor X. This robotic-assisted spine surgery is only available in San Diego and in fact in all of California at Scripps Memorial Hospital in Encinitas. This robot aids surgeons with 3D software modeling, planning, and guided placement of surgical implants. Robotic spinal surgeries using the Mazor X actually take less time, which is great for the patient. The less time you're in the operating room under anesthesia, the faster your recovery is, and the robot is obviously very precise. Anybody have any problems sleeping? Particularly after this week. Let me pass this around. A typical sleep study in the hospital costs a couple of $1,000s. And seriously, whoever gets a good night's sleep in the hospital, right? But what if we hooked you up in the comfort of your own home using this wireless multi-sense patch? You're in your own bed with your own sheets and pillows, blankets, and comforting. You're much more relaxed. We think we can get a much more accurate diagnosis for a lot less money. In fact, we've had patients at the Scripps Viterbi Sleep Center wear the multi-sense patch for 7 days, 6 days at home, and then one night all totally wired up at the sleep center. We were studying patients who had sleep apnea because if left untreated, it leads to chronic fatigue, falling asleep at the wheel, strokes, and heart attacks. We're still analyzing the data, but it appears that the patients are a lot more comfortable just wearing that little patch at home. Now, this is called the CardioMEMS. It is the first and only FDA-approved heart failure monitoring device. A dime-sized sensor is implanted in the artery during a non-surgical procedure. It measures pressure in the artery. Increased pressure is often one of the first signs of worsening heart failure. Heart failure occurs when pressure inside the heart increases. You get the shortness of breath and the swelling in your legs and ankles. 670,000 new heart failure cases are diagnosed each year. This breakthrough technology keeps heart failure patients out of the hospital, improving their quality of life. The CardioMEMS allows us to continuously monitor patients and detect how they are responding to medication and lifestyle changes. Dr. Thomas Haywood and his colleagues at Scripps were the first in San Diego County to implant the CardioMEMS after it was approved by the FDA. So the sensor lasts a lifetime. I mean, this obviously looks really big, but that's how tiny it is right there. It's powered by radio frequency energy. It doesn't require batteries. Once implanted, the device sends pressure readings to an external electronic system. The patient feels nothing. There's no sensation during the readings, which takes a few minutes in the comfort of the patient's home. Data from a clinical trial showed that the device reduces hospital readmissions from heart failure up to 37%, so we can monitor the person at home, which is better for the patient. And then there's the LVAD. This is for patients with a severely failing heart. It helps pump blood through the body. For some patients, it becomes their lifeline and can restore a healthy and productive lifestyle. It can also buy patients time until a heart transplant becomes available. Patients like Darla Calvé, she received an LVAD back in 2014. Her new donor heart, it became available in March of 2015. Scripps also took care of, anybody know the name of Rod Carew? Hall of Famer Rod Carew, right. Rod Carew had an LVAD at Scripps too, and then waited until a donor heart became available.
We became doctors to see patients that have problems and to make them better. And what better experience than to take somebody who's dying and give them their life back, so that a child has their father, or a daughter has their mother, or a wife has her husband. That's really what it's all about.
Scripps is involved in stem cell research, cartilage cells to help arthritis, stem cells into the heart to regenerate a damaged heart muscle. And who knew that a 3D printer could revolutionize healthcare? Dr. Daryl DeLima, who heads up orthopedic research at Scripps, at the Shiley Center for Orthopedic Research and Education at Scripps Clinic, what we call SCORE, he is currently working on using stem cells and 3D printers to assemble living tissue. Now, I know this sounds like science fiction, but within a few years, Dr. DeLima wants to have a 3D printer in the operating room and using stem cells be able to custom print new cartilage directly into the body, layer by layer, to replace tissue that is missing because of injury or arthritis. So you think about this, stem cells and 3D printers replacing cartilage so you will not have to undergo surgery for a total knee replacement. Obviously less trauma to the body, faster healing, much less expensive. Check out this wild ultrasound for the heart. The traditional echocardiogram in the hospital costs up to $300,000 and it takes 45 minutes to do the study. This V-scan sits right there on your smartphone and it costs $8,000. And the study, it takes a minute, so your doctor can actually show it to you in real time. It is portable, it goes anywhere your doctor goes. According to the American Journal of Cardiology, these handheld ultrasounds detect 53% more heart abnormalities than traditional stethoscopes. Now this device, this one checks your heartbeat. It snaps right up there onto your smartphone. It pops right up on the screen. You'll be able to send it anywhere. You can show your friends, you can show your kids or your grandkids. You can post it on Facebook if you want. Or more importantly, you can send it to your cardiologist's office. So if you're lightheaded or dizzy, it'll give your doctor rapid real-time information. In fact, one of our doctors was on a cross-country flight and a man was having symptoms of a heart attack, and so over the PA system they said, if there's a doctor on the plane, please come to the back of the plane. So he goes to the back of the plane with a couple of surgeons, and they think this guy's having a heart attack, but at 30,000 feet you kind of want to be sure, and sometimes indigestion mimics the symptoms of a heart attack. Surgeons are like, yeah, we think maybe he is. He goes, just a second, he goes back to his briefcase, takes out the device, puts it to the man's chest, sees in fact that he is having a heart attack. They make an emergency landing, take the man off the plane, and save his life. We're going to just have our cardiologists flying around the country from here on out. We help folks like Switzerland's speed skiing champion, Philippe May. Philippe is one of only 5 men in the world to roar down the mountain going 156 miles an hour. When Philippe was just 6 years old, his dad and his uncle both died suddenly in their early 40s within days of each other, most likely from a heart attack. No symptoms, no warning. Philippe came to Scripps after arriving in San Diego to compete in a grueling bike race, the Race Across America, nonstop from San Diego to the East Coast. He arrived here lightheaded and dizzy. Scripps cardiologist Dr. John Rogers found that Philippe had a genetic abnormality called ARVD, most likely the same one that killed his dad and his uncle. Dr. Rogers implanted a tiny defibrillator into Philippe's chest and can now monitor Philippe no matter where he is anywhere in the world. If Philippe's heart stops, the defibrillator kicks in and gets his heart beating again. Philippe put his plans on hold while Dr. Rogers remotely monitored his heart from San Diego, but he came roaring back, becoming the 2015 Swiss speed skiing champion again. And then Philippe decided to top that off by hiking up 19,000 feet to the top of Mount Kilimanjaro, with Scripps monitoring his heart all the way right there on Dr. Rogers' cell phone.
Something that is monitoring my heart 24 hours a day, and it's just a little box inside my muscle. It's great.
I'd like to thank Scripps as well as Dr. Rogers for saving Philippe's life and also saving his way of life and giving us the opportunity to have a future together.
So Philippe is going to compete again because that's who he is. It's really the only way he knows how to live life, and that's full speed ahead. In fact, in April of 2017, he placed first again at the World Cup Speed Skiing Championships in Europe, and he set a course record, just zooming down the hill at 125 miles an hour. And at Scripps, that's what we want for all of our patients. So we want to help them live the life that they want. Now, all of these gadgets are great if the patient uses them and is not stressed, but is rather energized by them. I would like to end with a gadget of epic proportions. Epic is Scripps' new electronic health record system. Epic is used by the top healthcare systems in the US, the Mayo Clinic, the Cleveland Clinic, Stanford, Johns Hopkins. It is the best, most sophisticated system for sharing healthcare information between you and your doctors, between your doctors and our hospitals. It is very user-friendly. We started rolling it out April 1st, first to all Scripps Clinic and Scripps coastal sites. It is an epic undertaking, and it will take about a year to get it fully implemented, so please be patient with your doctors and staff as we get it ramped up. But it means no more searching through mounds of paperwork. Your electronic health record will be there on the screen, easy for you to see, for you and your doctor to see. You'll be able to schedule appointments, you'll be able to pay your bills, request prescription renewals, review your test results, and those of your kids and perhaps the elderly folks that you're taking care of. And if you end up needing care outside of San Diego, let's say you're on a trip across the country and you end up in the hospital. Whoop. What happened? And you end up in the hospital and you end up with no voice. Hello? There you go. Let's say you're across the country and you end up in the hospital at the Mayo Clinic or Massachusetts General, Mount Sinai Health System in New York City, or Duke University in Raleigh, Durham, North Carolina. Those hospitals will have the same access to your medical records. Epic transfers 1.25 million patient records between health systems every day. So the country is going to be interconnected, and that is epic news in terms of improving the quality of care for patients. So there's a gazillion apps and gizmos out there. How many of you have an app on your phone which tell you how many steps you take every day, right? Okay. But let's face it, a gadget, it might look cool and do sparkly things, entertaining things, but at Scripps, whatever we use has to improve your life. It has to help you sleep better, lower your cholesterol, your blood pressure, detect cancer earlier, because we're all going to live to be 100, right? And we want to live rather than just exist. So for us, gadgets and gizmos may look cool, but they also need to meet the burden of proof. They need to lead to that third G, gadgets, gizmos, and good health. Think about that tonight before you say goodnight to your cell phone. Thank you.